You can't get Ebola through the air. You can't get Ebola through the water. You can't get Ebola through food. It's time for us to stop our xenophobia about Ebola. Wikipedia.com defines xenophobia as, quote, the unreasoned fear of that which is perceived to be foreign or strange. Xenophobia can manifest itself in many ways involving the relations and perceptions of an in-group versus an out-group, including a fear of losing identity, suspicion of its activities, aggression, and desire to eliminate its presence to secure a presumed purity. Xenophobia poses a real threat where Ebola and other emerging infectious diseases are concerned because it can delay self-reporting. It also negatively impacts the treatment that people receive during epidemics, the treatment of healthcare workers returning from impacted areas, the number of future healthcare workers willing to volunteer, and ultimately our safety as fewer professionals volunteer and the virus spreads unchecked. How is our response to Ebola xenophobic? Well, in two ways. First, we are terrified about the possibility of contagion, and Ebola is a newly emerging infectious disease, which is foreign to us. So we're xenophobic about the virus itself. This is evidenced by mandatory quarantine of healthcare workers, soldiers, and others returning from Ebola-stricken countries in West Africa, even though they exhibit no symptoms. And also by the questions they now routinely ask you at the doctor's office concerning recent exposure to Ebola. We had a similar reaction to both AIDS and SARS in the beginning. And second, we're guilty of social othering in relation to Ebola. According to Laura C.A., Assistant Professor of Government at Colby College, and Kim Yi Dion, Assistant Professor of Government at Smith College, quote, othering happens when an in-group treats other groups of people, in this case the African people, as though there is something wrong with them by identifying perceived flaws in the out-group's appearance, practice, or norms. An example of this is a recent Newsweek magazine article entitled, Smuggled Bushmeat is Ebola's Backdoor to America. Here's the cover. This appeared in the August 29th issue and addresses the African practice of eating bushmeat. The article goes further to label the smuggling of contaminated meat into the U.S. a risk factor for an epidemic here. This adds fuel to the fire of stigma for this population, which is already faced with stigma because of the Ebola outbreak. It reinforces their outgroup status. The CDC has even put out a publication to help West Africans cope with stigma. And here it is here. See if you can see it. Ebola information for West Africans living in the United States. And it reads in part, West Africans in the United States may face negative responses from people in their community because of the current Ebola outbreak. People may say bad things about you or try to stop you and your family from everyday activities like work, school, shopping, or spending time with friends. This is known as stigma. Stigma mostly occurs because of fear. People fear Ebola, and the disease is linked with a specific region of the world. You are not more at risk for Ebola because of your specific race or country of origin. According to Dr. C.A. and Dion, Newsweek's use of a chimpanzee to represent a scientifically invalid story about an African disease is a classic case of othering. Remember when the AIDS epidemic first began and our shunning and blaming of homosexuals? Or the SARS epidemic and the prejudicial treatment of Asians in Chinatown, even though there were no cases of SARS at all in Chinatown? In their article appearing in the scholarly journal Clinical Infectious Disease, entitled The Public's Response to Severe Acute Respiratory Syndrome, SARS, in Toronto and the United States, Doctors Blendon, Benson, DeRoche, Raleigh, and Taylor-Clark state, quote, prior research has shown that anxiety and misperception can cause, at the extreme, instances of panic flight from the outbreak area or refusal to comply with quarantine efforts. Public reaction to past outbreaks has also had other negative consequences, including unnecessary or overwhelming demand for healthcare services, inordinate or erroneous precautionary behavior, avoidance of places and activities that bear a low risk of infection with resulting negative effects on the community and its economy, inappropriate refusal of or demand for vaccination stemming from misinformation about the safety and effectiveness of vaccines, and avoidance of hospitals and healthcare facilities out of fear of becoming infected by others. Another problem associated with the fear of becoming infected has been discrimination against groups of people perceived to be at risk, even if few people in those groups are actually contagious. Xenophobia poses a real threat where Ebola and other emerging infectious diseases are concerned. So how do we stop xenophobia? Truthfully, it's probably impossible to completely stop it until we have a means of preventing, treating, or curing Ebola. But there are some things we can do to keep it from escalating. First, we can end extreme containment measures for asymptomatic people. Enough is known about how the virus infects that we know extreme measures are not necessary. Simple monitoring of symptoms should replace 21-day containment. This policy is contrary to those implemented by Governor Chris Christie of New Jersey and Governor Andrew Cuomo of New York, but it is in agreement with the Center for Disease Control's recommendations. And second, we need to continue educating the public now and during times when the epidemic wanes. And at the same time, we need to reassure the public about their personal safety during Ebola outbreaks. Reassurance is something that's very important because it tempers the fear created by warnings, images, and sensationalized stories. The public has not gotten enough reassurance to date. Without education and reassurance, the fear will continue to escalate. But we can learn from past experience. Today, there's still no cure for HIV, for instance, but we know how to live without fear in its presence. But it took a decade to resolve our xenophobia. Why wait so long and potentially put others at needless risk?